Breaking news this Wednesday, a Canadian military helicopter missing off the coast of Greece. The search and rescue operation underway. Moving ahead, more provinces announce plans to relax some restrictions, and in the U.S. fears the death toll could be significantly higher than reported. COVID-19 consequences, the cost to Canadian businesses, as BC restaurants propose a recipe to reopen.
We're probably down about 90% in revenue.
Striking the balance between safety and success. And optimism in flooded Fort McMurray.
Ice jams are beginning to clear.
What could be a turning point in a community that's been through too much.
Global National with Donna Friesen.
Good evening and thanks for joining us. We begin tonight with breaking news. NATO has confirmed it is investigating an incident involving a Canadian military helicopter that's gone missing off the coast of Greece. It was taking part in a NATO mission there, flying off the back of HMCS Fredericton, which is based in Halifax. Ross Lord is in Halifax tonight. Ross, what more can you tell us?
Well, Donna, specifically, NATO is saying there's a search and rescue operation underway involving a helicopter from a ship under NATO command. But the Canadian forces are now confirming contact was lost with a Cyclone helicopter as it was deployed off HMCS Fredericton. Reports in Greek media say the helicopter went missing between Greece and Italy. The Fredericton was deployed in January and has been conducting maneuvers in the waters around Europe. It made a port of call in Italy around the time the pandemic broke out there. The military decided the frigate could complete its mission in spite of the virus. So they're halfway through a 6-month deployment in the Mediterranean, part of something called Operation Reassurance, aimed at supporting NATO in Central and Eastern Europe. As for the Cyclones, they're relatively new. They replaced the old Sea King helicopters, and they act as a frigate's eyes and ears on these overseas deployments. They typically carry between 4 and 8 people. Canadian Forces says as it's an evolving situation, it has no further information at this time.
Okay, Ross Lord in Halifax, thank you. Now to the COVID-19 crisis. There are more signs parts of this country are cautiously moving to relax some of the restrictions we're living under. What's changing really depends on where you live. There are huge regional differences in how COVID-19 is spreading and being contained, and that impacts how provinces are responding. More than 1,500 new cases were reported across the country today. In some places, though, the number of new cases has slowed to a trickle or stopped completely. New Brunswick recorded its 11th straight day with no new cases. But Premier Blaine Higgs remains cautious. He has banned all temporary foreign workers, even though many farmers rely on them.
Just this week, we're seeing reports that Singapore, which had a great deal of success in fighting the virus early on, has suddenly had a huge increase of cases. This spike has been attributed to temporary foreign workers entering the country. We cannot allow a similar situation to happen here in New Brunswick.
Quebec is still the hardest hit province, recording more than 830 new cases today. Most of them are in long-term care homes. So are the deaths. So that province is pushing ahead, though, with plans to reopen daycares, primary schools, and some retail businesses. It also plans to ease some travel restrictions within the province. Ontario reported 324 new confirmed cases today. That's the lowest daily increase in 3 weeks. But Premier Doug Ford says it is still too soon to set a timeline for reopening.
I'm just not going to chance it. We've worked so hard. We've come so far in this fight, and all of a sudden we're just going to start rolling it out. We're going to do it responsibly, thoughtfully, and cautiously.
In Manitoba, there is good news tonight for people needing a haircut or a trip to the dentist. A number of non-essential businesses will be allowed to reopen on Monday. Eric Sorensen looks at the progress being made in Manitoba and the patchwork of plans across the country.
Manitoba turns towards a new normal on Monday, a province where there are 4 times as many recovered cases as active cases of COVID-19.
Today's good news.
The Premier announced Manitoba can now open gradually. Next week, many retail businesses, restaurant patios, and hair salons can open. Non-urgent surgeries can resume. Medical services. Day camps can open. It'll be another month, though, to dine inside restaurants, and non-contact children's sports is coming. all made possible because Manitobans kept their distance and, says the Premier, kept calm.
For all you've shown each other and the country through your strength and your empathy and your courage.
Manitoba's not alone. New Brunswick is allowing families to socialize with one other household. Almost all New Brunswick COVID patients have now recovered.
Our goal all along has been to flatten the curve, and we are achieving that right now.
The curve is flattening, even in Quebec and Ontario. A little bit sharper rise in Alberta, but for British Columbia and several other provinces, the numbers are tailing off. Now, here are the number of confirmed cases for the month of April. Quebec has by far the most, Ontario second most, but that's not just because of the biggest populations. If you look at it per capita, it really breaks into three groups. 6 provinces are doing relatively well, starting with British Columbia, with 20 cases per 100,000 population over the month of April. Plus, Saskatchewan, Manitoba, New Brunswick, Prince Edward Island, and Newfoundland and Labrador. All of their cases have been coming down. Now, there's that second group that are fighting persistent outbreaks, led by Ontario with 90 cases per capita, along with Alberta and Nova Scotia, which have seen their numbers rise more recently. And then, of course, there is Quebec, where they have by far the most cases and the most cases per capita. It is a struggle day by day in Quebec. Some worry Quebec is being hasty, sending kids to school next month.
I certainly do not agree with Quebec deciding that they want to do that quickly.
Provinces with smaller or rural populations do benefit from less density, but should not assume they're in the clear.
You are in danger when you are around an infected person, whether that is in downtown Toronto or in the middle of a wheat field.
Some provinces are doing better, others not, but the advice remains the same. Keep your distance. Eric Sorensen, Global News, Toronto.
In Toronto, 3 staff at an emergency childcare centre for children of essential workers have tested positive for COVID-19. That facility has temporarily shut down as 2 other staff and 2 children await their test results. The centre is one of about 140 operating in Ontario for essential workers. Without childcare, parents of young kids can't return to work.
After what happened yesterday in childcare, a small incident in one of the places, I want all childcare workers tested as well. I want to protect our children. That's our number one priority, make sure they're safe.
Businesses are figuring out how to survive and how to adjust their operations so they can safely reopen. Some new data was released today about the state of Canadian businesses. There's also concern about how outbreaks of COVID-19 inside some big beef and pork processing plants in Canada and the U.S. might impact the food supply chain. David Akin is tracking the government response tonight. David?
Well, Donna, Prime Minister Justin Trudeau did not offer any specific plans to deal with the supply chain problems affecting beef and pork products. Government is still talking with the industry, but the Prime Minister did say that the safety of workers in those processing plants is at least as important as making sure there's enough hamburger and bacon on grocery store shelves.
The priority for us is both things, keeping people safe and ensuring a good supply of food to Canadians. We will make sure we're doing them both together.
David, Stats Canada has compiled data with the cooperation of the Canadian Chamber of Commerce about the impact the shutdowns have had on a whole range of businesses. What does it reveal?
Well, Donna, no surprises here. This pandemic has hit business very hard. StatsCan says half of all businesses in Canada have recorded revenue declines of 20% or more for the first 3 months of this year compared to the first 3 months of last year. But 1/3 of all businesses that responded to the survey have seen sales drop by 40% or more in the first quarter of 2020. That drop in sales has led to widespread layoffs. StatsCan says 48% of businesses in Quebec have been forced to lay off some employees. That's the highest in the country. The national average is 41%. The lowest is in Saskatchewan, where just 34% of businesses have been forced to lay off some employees. The hardest hit businesses are, no surprise here, in the accommodation and food service sector. 68% of those businesses have furloughed some employees. And in fact, 1 in 4 businesses in the accommodation and food service sector have laid off all of their workers, 100%. The sector experiencing the fewest layoffs, that would be agriculture and fishery. Just 14% of firms in that sector have reported having to make any layoffs. Donna?
All right, David Akin in Ottawa, thank you. The UN's Labour Agency released a snapshot of the global impact of COVID-19. It says nearly half the global workforce is at risk of losing income. The International Labour Organization projects 1.6 billion people could lose their livelihoods because of COVID-19 lockdowns. It says people doing informal work with little support or job security have lost about 60% of their income during the first month of this pandemic. It says no income means no food, no security, and no future for millions of workers. There's also some new data on how the American economy is taking a hit. The GDP in the U.S. contracted 4.8% in the first quarter. It was the worst quarter since the 2008 financial crisis, and the worst is yet to come because that data looked at January through March. Many businesses, of course, shut down in mid-March. It's all bad news for Americans and for the U.S. president. Donald Trump is up for re-election in November, and a dismal economy is the last thing he wants. Right now, more than 1 million people in the U.S. are known to have been infected with COVID-19. That's not a full picture, though, because not everyone is being tested. About 60,000 people in the U.S. are reported to have died from COVID-19, and that makes up more than a quarter of all COVID-19 related deaths in the world. As Jackson Proskow explains, though, the death rate in the U.S. is probably not accurate either.
It's been like this for weeks. Thousands of deaths from COVID-19 every day. Tens of thousands of new cases in all corners of the U.S.
You see the decline has been slow at best and still disgustingly high.
The official numbers only tell part of the story, according to data from the U.S. Centers for Disease Control.
If you're under-testing and you're undercounting the number of cases, then when people who haven't been diagnosed with COVID-19 die, nobody is thinking about looking into that as a possible cause of death.
In 7 states and New York City, the number of all recorded deaths from early March to mid-April was far higher than normal. 325% above normal in New York City, 115% above normal in Maryland. The gap between reported deaths due to COVID-19 and other deaths is staggering. In New York City, it means an extra 1,700 fatalities. In Illinois, an extra 700. In total, 9,000 additional deaths in just 7 hard-hit states.
You're going to have a hard time really trying to bring down that mortality rate when you're not counting it correctly to begin with.
And there's another complication.
We continue to see a number of positive signs that the virus has passed its peak.
Despite claims from the White House that the worst is over, experts say it may not be, with the U.S. potentially nearing a plateau without a sharp decline.
We know that the rate of increase, whether it's cases, hospitalizations, or deaths, the rate of increase is declining, but the overall curve still shows an increase.
For the shortcomings in testing, there's good news on the treatment front. Dr. Anthony Fauci of the White House Coronavirus Task Force announced that clinical trials of a drug called remdesivir have shown it's potentially effective in helping COVID-19 patients recover faster. Donna.
All right, Jackson Proskow in Washington, thanks. A grim milestone for the UK today. It has now recorded the second highest number of deaths in Europe after Italy. More than 26,000 people are known to have died in the UK from COVID-19. The number jumped because deaths in care homes and outside of hospitals are now included in the count. And British Prime Minister Boris Johnson has become a father again. His girlfriend Carrie Simons gave birth to a son this morning in London. Johnson was at her side. He's just recovered from COVID-19 and he's expected to take paternity leave later this year. The baby is believed to be Johnson's 6th child and the 3rd to be born to a sitting British Prime Minister this century. There's a bit of an update tonight on 2 Canadian men who have been detained in China for more than 500 days. China's foreign ministry says they're in good health. Businessmen Michael Spavor and Michael Kovrig have been in detention since December of 2018 in what is widely seen as retaliation for the arrest of Huawei executive Meng Wanzhou in Vancouver on a U.S. warrant. Spavor and Kovrig were allowed limited consular visits, but that stopped in January when China suspended access to jails because of COVID-19. Tragedy and hope in Fort McMurray. Coming up, RCMP investigate a death as people keep a close eye on those ice jams. RCMP in Fort McMurray, Alberta, are investigating a death near the Athabasca River. It's one of the rivers with an ice jam that's caused extensive flooding. 20 kilometers of ice has forced about 13,000 people from their homes and put the area under 2 states of emergency. A mandatory evacuation order is in place in several areas. This is the worst flooding to hit the area in more than a century. As Heather Yourex-West reports, there are some signs of hope. The ice is beginning to clear.
Andrew Wall is feeling numb. In the last few weeks, he's dealt with COVID-19 restrictions, an unspeakable tragedy in his home province of Nova Scotia, and now a flood.
The area where we reside in town is completely either submerged or surrounded by water.
There is hopeful news.
We are encouraged to see the ice jams are beginning to clear on both the Athabasca and the Peace Rivers, and that water volumes are starting to go down.
Local officials expect water levels will crest in the next few days, around the same time as the community marks 4 years since the Fort McMurray wildfires. But the focus right now for those still here is surviving the current crisis. The simple act of grocery shopping has become even more challenging.
I got 5 grocery stores downtown that don't exist anymore. We had 2 trucks come in yesterday and shelves are almost empty again.
And there is still the threat of COVID-19. On Tuesday, Alberta health officials relaxed restrictions in the community, but officials say this only applies to people who are filling sandbags.
Dr. Hinshaw essentially gave a waiver for them to be closer together, and also, again, we're going to get them protective equipment so that the risk is reduced.
The province says it has sent more than 100,000 masks to the region to help protect evacuees both now and when they return. It's all a lot to take in. On Tuesday, a friend brought Andrew Wall a dartboard. He plays competitively. It was a small act of kindness, but in a time like this, it meant so much. Heather Yourex-West, Global News, Calgary.
Still ahead, a busy market in Syria turned into a place of mourning. This is the staggering devastation in northwestern Syria after a fuel truck was blown up near a busy market. It happened as people were shopping for food to break their Ramadan fast. More than 40 people were killed, 11 were children. The area was seized by Turkey 2 years ago, and it's blaming a Syrian Kurdish militia group, but there's been no claim of responsibility. In South Korea, a fire at a construction site is one of the deadliest ever in that country. At least 38 people were killed. There are fears others could be trapped inside the warehouse that's near the capital. It was under construction when the fire broke out. Investigators suspect it may have been triggered by an explosion in an underground level. All the victims are believed to be construction workers. A much-loved actor who got his start in Bollywood has died.
This will give the parents nightmares.
Irfan Khan went on to star in Hollywood blockbusters such as Jurassic World, Slumdog Millionaire, and The Amazing Spider-Man. He died in Mumbai of a colon infection. In 2008, he was diagnosed with a rare form of cancer, and he underwent months of treatment in the UK. Khan was just 53 years old. And a beloved community leader and humanitarian in Halifax has passed away. Mel Butley founded food bank programs that have helped feed tens of thousands of Nova Scotians. He was awarded the Order of Nova Scotia and the Order of Canada. Butley's family says he was diagnosed with a rare form of blood cancer in January and died of complications yesterday. His wife and loved ones were by his side. Butley was 92 years old. Open to serve while flattening the curve. Next, BC restaurants dish up a pandemic plan. Restaurants across the country have either shut down completely or are trying to survive doing takeout. BC is now looking at ways to get them back in business. Robin Gill explains how.
This Vancouver eatery is down to 4 staff in the kitchen. 30 servers and bartenders had to be laid off, but it's open to pickup.
We're probably down about 90% in revenue. Doing this sort of takeout delivery model, it's paying some bills, but nobody's getting ahead.
The restaurant business in Canada is already a tough slog. According to the National Industry Lobby Group, 80% will close within the first 5 years.
The average restaurant profit in Canada is about 4%. So take a model that's pretty challenged to begin with, now add these kinds of challenges.
In BC, the industry is pitching a new model for business unusual. The proposals include temperature checks for staff and customers when they arrive, masks and gloves for employees who pick up dishes, hand sanitizing stations, plexiglass between booths, limiting groups to no more than 10, and reducing the number of seats by 50% to allow physical distancing.
To put together a plan that deals with two things, essentially, is really, really high public safety standards that we've probably never seen before, because we need that in order to have public confidence.
But consumers can expect fewer items on the menu and a bigger bill at the end of a meal.
They're going to have to be doing that with the market being receptive to paying more for their food and beverage experiences.
Those restaurants that have agreed to the changes and followed protocols will have a certificate posted outside, because in this industry, it's all about survival in an economy that has become stagnant.
Hopefully by next year we forget all about this.
Reopening restaurants will be phased in, and the industry will likely be forever changed. But it may be the only way to bring back their employees and their customers. Robin Gill, Global News, Vancouver.
And that is Global National for this Wednesday. I'm Donna Friesen. Captain Tom Moore turns 100 tomorrow, and so many people have sent him cards, they've filled the hall of his grandson's school. Moore has raised more than £29 million for Britain's National Health Service by walking lengths of his garden. And today on Twitter he said, "It is quite extraordinary that I'm turning 100. It is even more extraordinary that I'm doing so with this many well-wishers, and I am in awe at the response my walking has had. To everyone who has donated, sent birthday cards and messages, sincerely, thank you. Please stay home, stay safe. Tomorrow will be a good day."